MD News Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on multiple healthcare information technology vendors. Here's what they had to say.
The chief complaint, chief issue, clean collections of claims, keeping their AR down. That is one of the markets that we serve, and not only do we serve it, we observe it and we look at it, and we see that when it comes to the point of getting a claim out the door, making sure that it's clean, making sure that it's going to land in the insurance company and get reimbursed on in a timely manner, everybody is challenged with it. Whether you're the one doc shop or you have 30 physicians strong, does not matter. Everybody's challenged with that.
They look at the current environment and they're saying, look, we're challenged because we've got to implement EMRs. We're challenged in the reimbursement arena because now with the high deductible health plans in today's environment, 1 out of every $4 is patient responsibility. As you guys know, that's one of the most difficult to go after. So they're saying, look, I'm having a challenge in today's world that doesn't even account for what's coming down the road. You know, is the accountable care organization going to be the predominant payment mechanism? Is it going to be a medical home? Is it going to be some payment for outcome? I can't keep up with it today. I'm certainly not going to be able to keep up with that tomorrow. And then you layer on top of that, I've got ICD-10 coming in 2013, you know, and my billing staff, the 4 or 5 people I have in my back office, can't keep up with those changes. I really need some help.
What we need to do is look at patients as really the center of what we're trying to do from a physician standpoint, from a provider standpoint, or even from a vendor standpoint, to ensure that physicians can deliver quality care and improve health outcomes. Well, in order to do that, technology is just a piece of the puzzle. And so there is reticence. The medical field is no different than any other industry, and people are not always open to change. And so when you come in and you start to electrify or digitize your practice, you have to go through a lot of different things. And the first one is human behavior. And it requires the entire practice to be advocates for the change, because it's going to impact everything they do on a day-to-day basis, from the way they run their front office to their back office, to the way they communicate with their patients, to the way they communicate with each other, and more importantly, to the way they engage with their patients as they are having one-on-one consultation with them and delivering care.
You know, one of the things that we see is organizations that have historically lost transactions. So when you look at deploying a software that helps you get more control over your billing services, yeah, we've been able to take AR from 75 days, sometimes down to 30 days. But that's a one-time fix, okay? Once you get your AR at 35 days, you're looking at the next way to solve a problem. Or if you get it down to 18 days, then we have some offices that are barely above 14 days. So yeah, we've been able to have a dramatic impact on cash flow. But that's only minute in comparison to having all of your claims get paid and make sure they're paid at the correct level. And that's really where our software fits. It's that we give our offices, our healthcare provider locations, more control over getting paid accurately. And then we've had as much change on the patient cycle, where patient AR used to be measured in terms of 90 to 120 days. We have some offices with some of the technology we've deployed reporting back to us that they're getting paid the same day that they send the bill out, through some of the e-commerce capabilities that we've been able to deploy. So there's some really monumental changes coming.
We've done a lot of studies, you know, specific to ROI. We were just speaking a moment ago to an 80-physician pediatric group that's here at the show that's just finished their implementation. And a lot of pediatricians don't feel like they're going to be able to qualify for ARA. There's not a lot of Medicare, if any, very little Medicaid, but they're forecasting that being able to meet all of the criteria and do that money based on the return on investment that they're seeing right now is well over 6 figures per physician. And in an 80-physician practice, that's very powerful information.
We have to remember that most small practices are very much like a small family business, and the people buy as consumers do. So it's much more of a B2C than a B2B purchase for that audience, and you need to take that into consideration as far as what their needs are and what the proper solution would be to meet those needs.